Fillers, retin-A, nip-tuck, facelift, all the things you hear women talking about.
But it's not just for women.
Nope.
So today, we go to Dr. Stanislaw's office in Avon to see the procedure one of his male patients rave about.
Absolutely. Take a look. While Dr. Paul Stanislaw says the majority of his clientele are women.
Can you give me a percentage of your clientele that's men versus women?
It's probably about 20% men.
20% men.
That percentage is changing.
I think a lot of that is also just health and social wise. For example, gentlemen who are in really good shape, so they could be in their 20s, they're working out every day, they have very little body fat. You'll see them and they'll be really hollow and flat through there. They'll have lost a lot of that facial fat, and it makes them look a lot older.
James Makio is one of them. He's 36 years old.
I came first time, maybe I was 32, 33. I've come so far 2 different times over 4 years.
You're looking at his before pictures.
For James, basically, again, very healthy, works out a lot, great shape, volume loss under the eyes, which makes you look tired, makes you look just people like you look tired all the time.
Genetics were also playing a factor for James.
I have some genetics throughout my family. We have a little bagginess under the eyes, and my grandfather had it, my father had it, and I just started to notice it. You know, getting especially coming out of the gym or doing anything physical, they really start to see the purpleness under the eye. So
it bothered you?
Yeah, it definitely bothered me.
So James decided to make the move to improve his appearance and went with Dr. Stanislaw.
If you really start to do your research, Dr. Stanislaw is one of few who really have the expertise in facial, fillers, and especially with men.
And that's exactly what James had done, facial fillers.
Basically, like around here and around right through here, and right around through here, and a little bit down into the cheeks. So basically coming from the cheeks up and around, and from the cheeks up and around.
Not just directly under the eye.
This whole general area, because what happens is you have to transition this into the cheeks, because it's not just under here, but this area starts to get hollow, so you have to come up and transition it into those areas.
I was here about an hour. They kind of numb the area a little bit, and then they just do an injection into the area, and doesn't particularly hurt. I mean, you're sitting there again just for about an hour.
The results are dramatic.
For me, staying young. I mean, I have a company that a big team that I run, and I'm the kind of the face of what's going on. So I think keeping the youth is not only good for personal, but also maybe a little bit of the business.
Men, Dr. Stanislaw says if you're unhappy about your appearance, do something about it.
When you're walking into your car, or you're walking into a store, and it's a sunny day, and you see the reflection of yourself in that glass or that mirror, and you see all those shadows where you never saw shadows before. My goal is to make those shadows go away. When you see it, when it bugs you enough to do it, that's when you do it. Right. So even if you're 72 and you see those folds and it bugs you and you feel like you're 60, then you do it.
It worked for James one more time. Here's the before and here's the after. Nice work, Doc.
Wow. That's crazy.
He made a handsome guy look even better. So we're going to have the link to Dr. Stanislaw's Facial Plastic Surgery Center on betterconnecticut.com. Thanks, Doc.